Welcome back to Fox 51 today. Wetting the bed. It can be a big problem for kids. It's definitely something that they have to deal with when they're going to sleep, and parents have to deal with it as well. So thankfully today, Dr. R.V. Gugay of the Sleep Medicine Institute of Texas is here. Some advice for parents.
And answers.
Yes, he's always got all the answers. Good morning, doctor.
Good morning.
Good morning.
You know, I'm sure bedwetting can be probably a very difficult topic to discuss with your children. You know, how would you advise parents to, really go about this problem?
Rachel, bedwetting can be a primary bedwetting problem, or it can be secondary to a sleep disorder.
Okay.
Almost 95% of all bedwetting is from a sleep disorder.
Wow.
So primary bedwetting clearly is it's normal to have a child wet the bed when they're not potty trained in that early age. But once they have become potty trained, bedwetting should go away in about a year or so. So by the third, maybe the fourth year, the bedwetting problem should disappear on its own. If it does not, then there is a sleep disorder that is more likely to be the cause of bedwetting.
And we've talked before about sleep apnea. Is it bedwetting linked to that, and what other disorders is it, or just primarily that sleep disorder?
I think you've nailed it, Robert. Sleep apnea is perhaps the biggest cause of bedwetting. A lot of times we look at other conditions, spina bifida, bladder issues. These kind of things are so uncommon. Sleep apnea is a hereditary problem, as you know. So if a parent snores, it is likely the child may have sleep apnea as well.
Well, now, if your child is wetting the bed, is this something that they're going to grow out of, or is this something that we need to get some sort of treatment for?
Typically, by the third, fourth, or maybe the fifth year of their life, they should grow out of bedwetting if that is a primary bedwetting problem by itself. But if it is secondary to a sleep disorder, it's unlikely that the child would grow out of it. However, as the child grows, their deep sleep lightens. And as their deep sleep lightens, as they get into a prepubertal or peripubertal age group, as the deep sleep lightens, then they may actually wake up instead of wetting the bed to go to the bathroom. So their bathroom trips occur at night instead of the bedwetting. But the pathology of sleep apnea might still be there underlying the process.
What would a parent need to see are signs for sleep apnea? What are some of those signs? Obviously, you would have to kind of be in the room to maybe slip in at night while they're sleeping. What do you look for a child that may be exhibiting? Well, obviously, if you have the bedwetting, your flag is up going something's wrong, or your attention's up. What do you do though what are signs for sleep apnea?
Well, Robert, at that age, 4 and 5 and 6 years of age, mouth breathing during sleep is a very common symptom. Acid reflux, spitting things up, that's a common symptom. Getting recurrent upper respiratory tract infections or ear infections, or having to have ear tubes put in for tonsillitis and things like that. These are common manifestations of childhood sleep apnea.
What is the point when we, as say a parent needs to take their children to a sleep specialist?
I would say by the age of 4 or 5, if the bedwetting has not disappeared.
Okay.
And you're getting the child to wet the bed at least once or twice a month, definitely you need to seek help at that point.
All right, well, this is some great information. If we want to find out more, sleeptyler.com is a wonderful place to go.
Absolutely.
Thank you so much for stopping by this
Appreciate it.
morning.
Thank you, Rachel and Robert.